Good evening. This is Kim C. Brooks coming to you live on our first episode of Now You Know. A little bit about myself. I have been in the healthcare profession now for about 20 years. I'm currently working as an ER provider, seeing patients on the front line as we experience this pandemic in our nation known as the coronavirus. Well, I got the inspiration to do this video after reading my email this morning from our CEO in regards to policies and procedures that are now being implemented to help combat the spread of this coronavirus in our community. I'm so glad to see how the three hospitals, Coliseum, Navicent Health, and House of Medical Center, how they have come together to present a united front to the community and trying to minimize the spread of this disease. As I was reading my email, of course, the email was highlighting different order sets we need to put in for patients suspected of coronavirus, different guidelines that we need to be implementing as providers. But the thing that caught my attention the most was the clinical trials that they're actually doing to treat this coronavirus. One of the drugs that kind of raised an eyebrow to me was the drug Kaletra. Kaletra is being used with an old malarial drug, I think hydroquinone, if I'm not saying it correctly. But they were using these two drugs to see if this would help to stop the spread or kill the virus. So for those of you who don't know, Kaletra is an HIV medication. So apparently in Wuhan, China, where the center of the coronavirus started, scientists, researchers have been desperately trying to find a drug combination to find a cure for this disease. To everyone's surprise, the HIV medication does not work. Kaletra does not work. Kaletra does not kill the coronavirus, and it's an HIV medication. I say that to say, people, this thing is serious. It's very serious. If an HIV medication can't kill the virus, that lets you know that this thing is taking people's lives. I went on to finish up reading my email, and as I got more curious about the drug, I ran across a pathologist named by the name of James Robb. Google him if you have time today. James Robb is actually a pathologist out of California who states that he is a virologist, and a virologist is a person who studies viruses. Guys, this man has been studying the coronavirus since the 1970s, 1972 to be exact. During this time, I guess there was a big outbreak of coronavirus over there on the West Coast. I'm not sure. But as this coronavirus has gotten worse, Washington State has been a hotspot for the strain of the coronavirus that's come about. So Dr. Robb pretty much wrote a letter to all of his friends and all of his colleagues, urging them to take preventive measures. And I read the article, and just some of the highlights from the article. Of course, flu season runs from typically October to April. So we're in April right now, and we're hoping that people are really, really paying attention to what's going on and not letting their guard down. Flu season is still in maximum effect. People, please do not, I repeat, be confused by this warm weather that we are getting. Flu season is still in full effect. What I'd like for you guys to know is that Some of the highlights that he pointed out include making sure that you are sanitizing your hands, that you're using a sanitizer that's greater than 60% alcohol base. You want to have those sanitizers in your car. You want to have those in the entrances of your home, in your garage, anytime that you're coming back from being around a large public place. And on that note, coronavirus is not an airborne disease. It's a droplet problem. When I say droplet, is when people sneeze, the droplets from their nose or the cough from their mouth comes out and gets on surfaces. People touch those surfaces, and in turn they touch their face. So the only way that this illness can enter your body is through your nose or your mouth, and that comes from touching a surface that has been contaminated with the actual droplets from the coronavirus. Okay. He also urges people to, wear your surgical mask if you are out. He asked them to get the zinc lozenges. The zinc lozenges, as many of us know, zinc helps with your immunity. Foods that are high in zinc include mushrooms, lobster, crab meat, oysters, cereals. I'm trying to think of some other things, but these are foods that help guard against your immunity. So, with that said, I would like to advise everyone to protect yourself, recognize the seriousness of this disease. Dr. James Robb, like I said, is a virologist. He studies cells. He studies how cells replicate. When cells replicate, or when they copy themselves, that's what I mean when I say replicate. When cells copy themselves, they start to mutate if a certain part of the gene isn't correct. And this is what's happening. This thing is replicated, and it's affecting people only at the respiratory cells. That's why people are having to go onto ventilators. That's why people are requiring extra oxygen support. This is not a disease that affects the kidneys or the heart. This thing is affecting the respiratory system. So that's why you've really got to be mindful, especially in this pollen season, which myself suffer from pollen, always having the itchy eyes, runny nose. You've got to be very, very diligent about washing your hands, about making sure that you're sanitizing your hands. When you're washing your hands, you want to make sure you're washing for at least 10 to 20 seconds, just vigorous scrubbing. Keep that in mind. Right now, they do have some clinical trials out there that are being done. Like I said, the Kaletra drug was one of them, the HIV medicine that didn't work. I know they're doing a clinical trial with losartan. So people who are taking it for high blood pressure, that's an increased incentive to take your blood pressure medicine. And then again, I think they're talking about using the hydroquinone, the old malarial drug. People who have decreased immune systems, such as our patients with COPD, patients with immune problems, lupus, rheumatoid arthritis, any kind of inflammatory disease that you may suffer with, you're at a level of decreased immunity. Okay, your cells are starting to go back and attack your own, your healthy cells are attacking your own body. So what I want you to do is keep your cells healthy. How do I keep my cells healthy, Kim? You eat right. You don't smoke. You don't drink. You get your water in. You got to keep your cells healthy. If you don't do anything else, make sure that you're keeping yourself healthy and you're keeping your cells healthy. This thing is attacking people's body at the cellular level. People, hear me. It's attacking the cells. I'll be joining back in later on this week to let you guys know of any updates that I have in regards to disease. But do recognize the urgency in my voice. The HIV drug couldn't take this thing away. It's serious. So I want you guys to protect yourselves, protect your children, and be mindful of the places you're going. Try to avoid large crowds by all means possible. If it's something you necessarily have to do, if you want to cover your face, if you have to use a bandana to cover your face, that's certainly appropriate. But do realize that this thing lives on the surfaces. And when you touch those surfaces and those surfaces go to your nose or your mouth, that's actually how the disease is entering into your body. Thank you so much for listening. I'll be back later this week with updates on the coronavirus 2020.